one thing that's always really bemused me, I think, about filler is lips are always usually the first thing you're taught. Was that the case with all you guys? Was lips sort of the first thing? And I think they're one of the hardest things to get right, myself. I don't think they're the easiest, and yet it's sort of filler course day one training, isn't it, lips? Why do you think that is? And should we be doing that? Is that right? Or is this way above and beyond this small little lecture series? What do you think?
I think there's a very valid point. When Bob and I started injecting 20 plus years ago, fillers were just that. We were filling potholes in the road. We were filling nose to mouth lines. We were filling mouth corners. Now it's about redraping, resculpting and replacing lost volume. Now, lips themselves, I don't like using the word filler in lips. I say, imagine we're using an injectable lip liner. Imagine we are restoring hydration and we are replacing lost volume. But they're a complex area. The lips are effectively a ring of muscle. They're a sphincter muscle, a bit like the muscle that surrounds the eye. And if you use the wrong type of filler or you inject it in the wrong area, that filler will start to clump and you'll end up with lumps in the lip. You can end up with nodules forming. You can end up with that trout pout where the lip actually starts to stick outwards most unnaturally. So practitioner choice is very important because it takes many years to get good at this. You don't go on a one-day course and suddenly become the best lip injector. So correct product choice, correct practitioner, and be subtle.
So let's talk through them patients. What would I expect? I'm coming in, I've had a little think, I've seen a nice photo in a magazine of someone who's had their lips done and I quite like that look and I'm thinking about having it because I've got a big wedding coming up. What's going to happen to me?
Great, so you should go in to see your practitioner and you should first and foremost, after being cleared or deemed suitable for the procedure, you should have a good long chat about what your expectations of treatment are and what they can give you and what is sensible to give you, what the product choice is, how it's going to affect on your life and what the aftercare is, how that's going to change your daily life, how you're going to feel about it.
How is it going to change? Tell me all the answers. I want to know all of this.
People want to feel, lips are one of those areas, it's one of the most commonly done cosmetic procedure, and that's probably one of the reasons why injectors learn to do it so early on in their training life. And it's one of the reasons why people go on these one-day courses and whichever in order to satisfy that demand of patients. And as a patient, or if you want to enhance that feature, it is more. It's not so much because you feel that there's something wrong, but it's often because you want to feel a little bit more self-confident, you want to feel a little bit sexy. It's because your upper lip may disappear when you smile. One of the most common complaints is, I have no top lip. When I smile, my lips go away. I don't feel confident. My teeth are too big. I show too much gum. Those are all things that patients come into the practice with. And they want to feel better about themselves. They want to put lipstick on and feel confident. And as a practitioner, you're there to guide them in that choice and make sure that that choice is the right one. Likewise, if I have patients who come in who already have very, very big lips and who are asking me to do something that is unreasonable or that would distort the natural architecture of the lip beyond such a point where it is attractive or in their best interest, then it is my responsibility as a clinician to say no.
But what are you going to say to me then? That's what I want to know. I want to know my journey through your clinic, just to outline for patients, not your clinic specifically, but an average clinic in general.
So you should come in for your consultation, have a good long chat, deem that you're suitable. When you are happy with your choice, and that, in some practices that may be on the same day, and in some practices you may come back for your treatment. Very often you come back for your treatment.
So I shouldn't think anything about that. If I'm told to go away and think about it for a few days, that's actually quite a good, important thing, isn't it?
You're changing your appearance potentially, you're spending quite a lot of money, and you need a period of consideration where you can adequately digest what you've been told about all the risks and the benefits and the option not to treat at all, and come back with the confidence to say, yes, you are the right practitioner for me and I want you to treat my lips in order to enhance them, in order for me to feel more confident, more sexy. Does it hurt? some practitioners will say yes, some practitioners will say no, and some patients will have varying opinions on that. Some practitioners treat with no numbing agent whatsoever, and that can be quite sensitive because the lips are a sensitive area. There's a reason people use them for kissing. Some practitioner will apply a numbing gel to the area for a period of time, but as a patient you should expect the practitioner to leave that on for a goodish long while and not just put the numbing gel on and then start straight away, because it does need some time to act. If you're going to practitioners such as dentists, you will often find that they will use an injected nerve block or local anesthetic, which will wear off after a period of time, sometimes half an hour, sometimes longer, and that can make the procedure almost completely painless. Which route your practitioner chooses is largely up to the practitioner of what they feel competent and safe to use, and what they are happy treating you with. So your experience as a patient can be varied. On the whole, I think no practitioner out there is out to cause anyone any pain, and most practitioners will see to it that as a patient you have as painless a procedure as you possibly can.
So it's going to take a lot longer than, say, a toxin treatment, almost certainly.
Sure.
You may not even have it on the same day, and that's a very reasonable expectation, actually. In fact, in many cases, I'd argue it's very important sometimes at that time, once you've found out all the facts,
Sure.
to just have another little few days to think about whether this is really what you want. Having just had my lips done, what's going to happen to them over the next couple of weeks?
Okay, depending on the material used, of course, there will be a degree of swelling and possibly some bruising. This can be minimised, of course, by various techniques. It's quite normal over the next 24 or 48 hours for a patient to experience a degree of swelling, but that is very temporary and it will go down. This can be aided by some ice of the area.
And does the effect happen immediately and stay, or what's going to happen over the next couple of weeks?
Okay, so as soon as you've had the treatment done with the particular type of filler, you'll get a result. You'll get an immediate swelling of the area. And then over the next 24, 48 hours, as I said, there will be a degree of pseudo swelling, which will then subside. And then the more realistic outcome would be around about 2 weeks, where the filler essentially is settled to a point that you can expect as a patient to see a more realistic result, which will be present for 6 to 10 to 12 months, depending on the particular material used.
I think it's important to acknowledge that any sort of filler you put in is potentially movable, isn't it, and play aroundable with for quite a long time afterwards. So that needs to be borne in mind, that you're not sitting there biting your lip at work because it's a habit, and you realise actually you've shifted all the filler that's been neatly put in and you've been left with a dent. That's not impossible, but it's just a bit of realisation about that. How does it tend to go wrong, do you think, and why?
The vast majority of fillers are now made from a substance called hyaluronic acid, which is a complex sugar. But each individual manufacturer has a different way of creating a gel. And some of the gels are what we call particulate, so like a transparent sort of rice pudding. Others are what we call homogeneous, so they're like a gel with no particles in. And the characteristics of the product dictate how it becomes part of the body. And when I'm describing it to a patient, I'll often say, imagine we put a blob of ice cream on top of a bowl of fruit salad. The ice cream sits there for a while, but then it melts and it finds its way in amongst all the fruit. And that's what happens in that first 2-week period once the filler's been injected. It integrates with the tissues and it starts to move with the tissues and become part of that lip or cheek or wherever you've injected it. And proper choice of the product and proper injection technique will minimize risk. But the risks and problems we tend to see are usually along the lines of if improper hygiene has been followed, or if the patient has had a cold sore, for example, recently, or a recent dental procedure, or a recent sore throat, there's a risk of an infection developing. Sometimes you can get delayed nodules forming where the body finds the filler and creates a temporary immune response and surrounds the filler, so you get a lump or a nodule appearing. And with some types of filler, you can find it accumulates in blobs, and when you actually look at the lip, you can actually see it almost like frog spawn underneath the skin. Those are minimised by proper injection technique, slow injection technique, and by using a properly experienced and accredited practitioner.
One thing I think it's really useful for people to know is that unlike with toxin, where you can't really reverse it, there isn't an antitoxin particularly. With filler, there is a substance that can actually dissolve filler in the case of either an emergency or where there's a real problem with the product and where it's being placed. So I think filler is often the area we're taught first, but I think it's quite complex. Now, an area that I personally don't touch, but I know that you guys do, is around the eyes. I just have decided I find them difficult, patient expectations often high, end result not always great, so I've just taken a personal decision that I don't tend to do that area with my patients. But around the eyes is often an area that patients are interested in having treated, isn't it? Do you do filler around the eyes?
I do indeed, yes.
So tell us about that. What sort of treatments would patients ask for, or would you suggest?
So patients often will feel that any ailments around the eyes can be solved by fillers. Sometimes surgery is the best option. There's no question about that. But when there's a clear defect or volume defect in this area, giving rise to a sulcus or a little indent, those sort of areas can be very nicely treated by replacing and replenishing the volume using a particular type of filler. The key really is putting the filler in the right place. Often what we find is the filler is placed too superficially, too close to the skin, and the product may be too thick, and that can lead to problems, nodules, little lumps and bumps, which can lead to migrational issues where the product can actually end up in the eyelid, for example. So it's key. I'm not surprised that you've chosen not to use this particular modality because it does have to be thought of as a more advanced, more complex procedure. Notwithstanding the anatomical concerns in this area, of course, this is often referred to as tiger country. The various nerves and blood vessels that are in this area that have to be respected. So a good technique in this area is crucial. Good product choice is crucial, and a good approach, and also learning to understand that not all cases can be treated. So case selection.
This is more than any other and a good example of where saying no is perhaps crucial. Either saying no completely if you're not confident enough as a practitioner, but where treatments are just not really approachable, and matching that expectation with what's achievable. But where an organisation like Save Face can really help you find practitioners that know what they're talking about, that have the experience and the training and are delivering the results to a standard that you would expect. I think that's very important, don't you?
Around the eye is such a high-risk area that I would always advise anyone seeking treatment to make sure you are seeking treatment with an appropriately qualified medical professional, be it a doctor, nurse or dentist. Do not go to beauticians, do not go to beauty therapists, do not go to anyone who doesn't hold a medical degree of some sort. Because if that goes wrong, then it can mean some serious problems.
Well, I don't want to be too tabloid in my approach to this, but of all the horror stories, it tends to be in this area that they most occur. Can you just talk through some examples of, some of the worst problems?
Well, the worst problems are usually associated with getting the filler into a blood vessel. Nerves usually regenerate fairly well if you damage a nerve, but if you get the product into a blood vessel, it can block the blood vessel, and wherever the blood that was in that vessel was flowing to no longer gets a blood supply. So I've certainly seen cases where the nose has gone gangrenous, the lip has gone gangrenous, and there are even cases now, most of them in the Far East, where they're doing a lot of high volume treatments to westernise noses, where the blood vessel has actually not only been blocked by the filler, but the filler has actually travelled to the eye and caused blindness. And there's well over 100 cases been described worldwide now, blindness due to filler injection, often in an area not close to the eye. There was a case only a few weeks ago with a lower lip being injected. 5 minutes later, the patient was blind.
So that's a very sobering thought, but it's not an exaggeration, is right? And that, I think it's really important to say two things. First of all, it could happen to any one of us. With all the best will in the world, all the most, the best experience, these things can still happen, and that is a risk that you take on when you essentially sign up for a treatment. That having been said, you can minimise those risks. There's a lot that patients can do in the homework and the groundwork and the back checks. There's a lot that SafeFace does for patients, but I think the patient should still check that SafeFace has indeed done that. That's really important. And there's a lot that we as practitioners can do, either by just avoiding the area completely, like the coward I am, or actually, by making sure you are practicing safely.